Assalamualaikum. My name is Aina Tunadia. I'm working in ICU King Faisal Hospital Specialist and Research Center in Madinah branch. This is the research presentation about the needle stick and the sharp injuries among ICU nurses in King Faisal Specialist Hospital, and the focus is on knowledge, attitudes, and practice for prevention. Needle stick injury are serious occupational hazard, especially for nurses who frequently handle needles and sharp instruments. They can transmit blood-borne infections like HIV, hepatitis B, and hepatitis C. The World Health Organization estimates that about 40% of Hep B and C and 2.5% of HIV cases in healthcare workers are caused by NSI. In Saudi Arabia, between 22 and 35% of healthcare staff have experienced them, with the underreporting being a major issue. Even though awareness exists, NSI prevalence remains in high Saudi Arabia, ranging from 37 to 85% depending on the hospital. Nurses at the greatest risk because of their daily exposure. Fear, stigma, and poor reporting system make it hard to measure the true scale. And self-practice, for example, recapping needles and lack of proper training is a contribute to the problem. This study also asks for main question. What is the knowledge level of ICU nurses about the NSI? The second, what are their attitudes towards the prevention? The third question, what practice do they follow? Is there a link between the knowledge, attitudes, and the practice? Okay, the next slide is the hypothesis. The study assumes that ICU nurses have educated knowledge, positive attitudes, and self-practice regarding NSI prevention, and that there is a significant relation between these three factors. This research also very important because it helps improve the workplace safety and reduce the risk of the infections among nurses. It can guide the hospital administrator in training programs, reporting the system, and policy development. It also supports national and global goals for occupational safety and infection control, and also provide a base for future research. Now we are going to the literature review slide. This chapter reviews the global burden, knowledge, attitudes, and practice, and also introduce the theories that guide this study. According to the World Health Organization, more than 2 million healthcare workers are injured by needles and sharp every year. Nurses are the most vulnerable. In Saudi Arabia, prevalence rates vary widely between 22% and 85% due to differences in safety, culture, and reporting. Nurses generally know the risk of NSI, but many lack details on guidelines and post-exposure measures. Attitudes are important. If the nurses believe the NSI are preventable, they are more likely to take precaution. However, unsafe practice such as recapping needles and poor disposal still exist, often due to workload and limited equipment. The causes of NSI can be grouped into three levels. First, the personal factors like stress and fatigue. Institutional factors like a staff shortage and system issues such as a weak safety policy and underreporting. Safety tools alone are not enough unless they backed by a strong safety culture. Training is a key strategy. Studies show that regular training improves the knowledge and safety practice. Safety engineered devices like retractable needles can reduce the injury by up to 80%, but their use is often limited by cost and supply. Safety culture in hospital plays a huge role. Many NSI are underreported due to the fear or stigma some of their nurses. A strong reporting system and supportive policy can improve the prevention. Okay, this study is guided by two models. The health belief models, which say people act when they feel at risk and believe prevention is worthwhile. And the knowledge attitude belief practice model, which show how knowledge shapes attitudes, then belief, and finally behavior. As a summary, NSI remain a serious risk for nurses worldwide and in Saudi Arabia. Despite awareness, unsafe practices and underreporting still continue. Training and safety devices and supportive policy are needed. The theoretical models help explain how the knowledge and the attitude can lead to safer practice. Now we are going to the last chapter, research methodology. Research methodology is basically the roadmap of this study. It's guide how data was planned, collected, and analyzed to answer the research question. A strong methodology improves the validity and reliability of the result. Okay, this study used a quantitative cross-sectional survey. That means the data was collected at one point in time to capture the current knowledge, attitude, and also the practice of nurses. This design is suitable for looking at the prevalence and association. Okay, this study also was carried out in ICU King Faisal Specialist Hospital, but based in Medina. Being a tertiary care hospital with many critical cases, it is an appropriate place to study occupational exposure like a needle stick injury. The population was all 99 registered ICU nurses. I'm using also the ROV software. The minimum required sample size was 35. I also use purposive sampling to include only nurses directly involved in patient care. So for the inclusion criteria, only for the registered ICU nurses providing direct care to the patient. Exclusion, that means the nurses like on leave or working in administrative or they are non-clinical duties. The mentors was a structured questionnaire adapted from Young and the colleagues. It covered demographic, knowledge, attitudes, and practices. Knowledge item was scored correct and incorrect, while attitude and practice used Likert scale. For the data collection, is collected using an online questionnaire via Google Forms. The links were shared securely through the email and also the hospital intranet. For the participation is only for the voluntary and it's confidential. So for the data collection process, the process involves the 6 steps. First, obtaining ethical approval. Second, developing and piloting the questionnaire. And third, sharing the survey link. The fourth, securing informed consent. And also participants completing the survey. And the last one, data being monitored and export for analysis. For the ethical approval, it must be granted and the consent must be obtained. Validity will be rechecked by the expert review. Reliability will confirm using the Cronbach Alpha, that is the knowledge score like 0.81, the attitude 0.87, and the practice 0.79, which are considered a good and acceptable levels. A pilot test for 30 nurses who were not part of the main study. The pilot helped check clarity, readability, time required, and reliability. Minor adjustments were made based on the feedback. For the data analysis plan, I'm using the SSO version 26. Descriptive statistic like the frequency, the mean, and also the standard deviation must be calculated. The knowledge score categorized, while the attitude and the practice score will be interpreted using means. Inferential tests such as t-test, NOVA, and Pearson's correlation will be applied, or with the significance set 8 p less than 0.05. So this is the presentation for the methodology research.